Okay, so listen up. If you think you've got a handle on the rules for managing cholesterol, you might want to think again, because the entire playbook for protecting your heart has just been rewritten. We are about to dive into the 2025 update, and trust me, it's changing everything we thought we knew. For decades, we've kind of been following this same standard approach. But with heart disease still being this massive global challenge, researchers had to ask a really tough question. Is what we're doing, is it really enough to win this thing? And it turns out the answer is a big, resounding no. So what we're seeing in these new guidelines isn't just a minor tweak here or there, it's a fundamental change in the entire philosophy. It's a true paradigm shift. So what is this big shift? Well, it all comes down to a change in perspective, moving away from just looking at a small window of time to looking at the entire arc of a person's life. For years, the key question was, what's your risk of a heart attack in the next 10 years? But now the focus is so much broader. The question is, what is your cumulative, your lifetime exposure to harmful cholesterol? This means it's not just about dodging a bullet in the near future. It's about preventing that damage from quietly, silently building up over decades. Of course, to make a philosophy like that work, you need much better tools to actually see that lifetime risk. And that's exactly where a new generation of smarter, more personalized assessment methods comes into play. At the heart of all this are the new SCORE2 algorithms, and here's why they're such a big deal. Older models often just focused on your risk of a fatal event, but these new tools, they factor in non-fatal events too, like a heart attack that you survive. This gives you and your doctor a much more complete, a much more realistic picture of your actual risk, which means you get a prevention plan that's truly tailored for you. And there's another piece to this puzzle, lipoprotein A, or what people often call LPA. The easiest way to think of it as a particularly sticky type of cholesterol that's largely determined by your genes. The new guidelines are officially recognizing it as a key risk factor. That means a simple blood test can help personalize your prevention strategy even more, especially if you have a family history of heart disease. So, once you have that clearer picture of the risk, you need the right tools to actually act on it. And the good news here is the therapeutic toolkit has just gotten a major upgrade. For years, the approach has been pretty linear, right? Doctors would usually start with a statin. If that wasn't quite enough, they'd add a drug called ezetimibe. And for the highest risk patients, the next step up was a powerful injectable called a PCSK9 inhibitor. Now, those classic therapies are still the foundation, but the toolkit has definitely expanded. Two new players are officially on the map. First, you've got bempedoic acid, which is a fantastic option for people who really struggle with statin side effects. And then there's inclisiran. This is a real game changer. It's a cutting-edge therapy that can lower cholesterol with just 2 injections a year. This gives doctors and patients so many more personalized and manageable options. And hey, it's not just about long-term prevention. For patients who are having an acute event, like a heart attack, the new guidelines are crystal clear. Don't wait. Start aggressive combination therapy right there in the hospital to immediately bring that risk way down. So, we have smarter assessment and more powerful tools. The next logical question is, what are we aiming for? And this is where the new guidelines get even more aggressive, guided by a very simple philosophy. This quote from the guideline report just says it all. When it comes to LDL, the bad cholesterol, there's absolutely no ambiguity. The science all points in one direction. Driving that number down as low as possible provides the greatest benefit, period. And here is what lower actually looks like in practice. The targets have been pushed down across every single risk category. Just look at the high-risk group. The goal is now below 70. For those at very high risk, it's a super aggressive target of less than 55. These are not small adjustments. This represents a major shift in treatment goals. But the guideline authors didn't even stop there. For the first time in history, they have defined an entirely new category for the patients who are at the absolute highest risk of all. And for these extreme risk patients, we're talking about people who've already had multiple heart attacks or strokes. The goal is now an unprecedentedly low LDL level of under 40. Wow, this is a level once thought to be extreme, but it's now the official target to prevent future events in these incredibly vulnerable individuals. Okay, so let's pull all of this together and see how these individual changes create one powerful, cohesive, new strategy for heart health. The logic is just crystal clear. You use smarter assessment tools to identify risk way earlier in life. You use an expanded, more powerful toolkit to intervene more effectively. You aim for much lower cholesterol targets to drastically reduce that cumulative lifetime damage. And of course, the foundation for all of this, the one rule that has not changed, is that a healthy lifestyle always comes first. This single sentence from the report just perfectly captures the spirit of this entire update. It's a call to action for doctors and patients alike. Don't wait for the problem to become severe. Intervene earlier, be more aggressive with treatment, and the ultimate outcome will be more lives saved. And that brings us to the final crucial point. Whether we think about it or not, the clock on our lifetime cholesterol exposure is always ticking. The question these new guidelines pose to all of us is this: armed with this new knowledge, what are you going to do about it? What's the next chapter you'll write?